It was really interesting when I met you today. First of all, you're adorable. But you have these. How long have you been dealing with these for?
Oh, this time about a year and a half.
Just that's it?
Well, he's had blackheads.
But they got really bad all of a sudden?
But they were just a few.
Really? But all of a sudden?
A couple of years, it's just been spreading.
See, 1 year to him is a couple years to us, you see? Yeah. So I'm going to push on you a little bit and see how well these respond here first. Sometimes they are a little tougher. I thought they might be tough because I bet you your wife and you probably try to get them out yourself, huh?
I did.
Yeah, and nothing didn't really work, huh?
No.
Okay, so I'm gonna poke a couple of them a little bit, okay? So just over here, I'm gonna give you a little poke. Let me see how you do with that. You're okay with that, huh?
Yeah.
Good. It's just a little pinch, and sometimes you gotta get them going. You know, like open the top off of them there a little bit, just to get them going there. Let's see if that helps a little bit. Just putting a little pressure on you. There we go. There comes some. Now we're giving you a little Retin-A because I do think that if we give you Retin-A, that will help to soften some of these and make them easier to express. But that's all you needed was a little poke, actually. Not even that bad. And you're okay, right? You pushing on you?
Perfect.
Now you said you have a job that required, I kind of asked, because sometimes when I see these ones like this, you know what they've been, the occupation that people have had has been, they've been like a fireman or something like that, where they're in the soot a lot.
Oh, yeah.
And he was kind of saying, yeah, he confirmed that he's not a fireman, but you were in
air freight.
Air freight. So you were, often you had jet fuel or like exhaust kind of on your face?
Right.
And when you came home, did you literally have to like clean yourself, kind of like someone who might work in a coal mine or something, like have soot on them? No, not quite.
See, the plane used to leave at 8 at night. And I never used to get home till 1:30, 2 o'clock.
In the morning?
Yeah, next morning.
Oh, I see.
I used to work between 9 and 10 hours.
And you had this voice issue since you were young. It wasn't because of lung issue, because of your exposed to this jet fuel, was it?
No, this is post-nasal drip.
That one that you were saying, yeah. Okay, I'm going to turn you a little bit towards me. Okay, I'm going to get this a little bit under your eye here. These are going to take a little bit, especially if you want perfection, if you really want to make a significant difference. So we're definitely going to be seeing you a couple times here. But I think we've been pretty successful so far, just your cheek. And see, I test you out too. I know now that you're pretty tolerant. The fact that I can poke you like this and you don't even budge. That's all good. That means we're gonna be successful here because you're gonna put up with me. Because there's a little pinch involved, you know. And a little pressure here. I try to push against your cheekbone to express these. There we go. Gosh, you're gonna lose like a little weight when you leave here. So do you feel like people bring these up to you a lot? Do they ask you what these are, or do they just?
It says me from when they be playing Zorro in a movie.
What was that?
Zorro.
Oh, Zorro? Yeah, like a mask, huh? It's like a blackhead mask you have on.
Right.
So I'm gonna push on you. I'm trying not to bruise you because under the eye, the blood vessels are really kind of fine. So I'm just trying to take my time and push against your orbital bone here. You can feel the pressure there, but you didn't even get any anesthesia, so you're tough. I know that. But what'll be interesting to see too is if when we give you Retin-A, whether those truly come out a lot quicker or not. Because that's what it's supposed to do. It's supposed to soften these to make it easier to express. You can see some of them are a little stubborn. There's another one I'm going to push. That one's a bigger one. Just going to do the wiggle. He's like, I treat them like they're people. They're like resisting me, and I'm like, come on, there we go. That one was worth it. That was a big.
I can tell you, there's body lotion on my
Right.
legs.
That's okay. I'm gonna put a little numbing here, so don't move around too much here, because I don't want to have it hurt you and make you jump like I just did on your leg. I just gotta numb around it so that you can't feel me kind of squeeze it out hard here. Because you said it keeps filling up, but it's been a long time since it's been squeezed out, so maybe it won't fill up this time. Let's take a look at it.
It wasn't deep, she said.
Twice.
Twice, and it's the biggest it's ever been, huh? It's under there.
The second time I had it removed,
It's bigger,
Mom,
wider
don't
than
talk
it
to me.
looks.
it was,
What do you
Stop
say?
talking.
Say that?
it wasn't the doctor, it was the PA, is that what you call them?
Yeah, physician assistant maybe?
Yeah, and said, oh,
It's
the
hard.
core was not removed, that's why it grew back.
See, I had my sound effects.
So I didn't.
Did you already get it?
No, I didn't. I didn't want to. We're interrupting you. I'm sorry. We're all like ignoring you.
That's okay.
I can't listen to
It's
her.
like a little plug in a faucet. Remember old school plugs, like those black plugs
Yeah,
that
yeah.
come out of a faucet? Oh, look at that. You want to see it?
No,
Not you,
Don't
not
show it to her. Don't show it
No,
to her.
really? Why?
Do you want to see it, Mom?
No.
No.
I told you.
Yeah. That's pretty wide. Come to this side. Come all the way over and see. Yeah. If I close that up, I think it's just gonna refill because the sides aren't refreshed. Like if you don't have cut edges, it won't stick
You
together.
won't see-
You know what I mean?
heal
So it's
together.
it's just like your own little coin purse. I am a comedian, huh?
No, I'm gonna.
Jeez.
Did they tell you something?
Rosacea.
Yeah, this is rosacea, but this particular type of rosacea here is called rhinophyma, where you get thickening of the skin on your nose, like very dilated follicles. See how that just kind of, all this stuff is just right under the surface, ready to come out. You should have seen it all squeeze right out of that one little hole there. So she's got a lot of dilated follicles and excess oil production on his nose, which creates these big bumps. So your nose is actually probably half the size of what it is here, or it used to be, certainly, right?
You think
Maybe smaller at least.
you're gonna make a smaller nose?
We're
out
gonna
of it?
give you a dainty nose. Yeah, a little pinch here. You're probably on some blood thinners or anything. Nothing like that?
Oh, no,
Maybe?
only
No? Just aspirin. You are
aspirin.
90 too.
90. Yes, 90 also. 90.
Oh,
90.
wow,
Yeah.
amazing. And you guys have been together for 70 years,
Yep.
and you guys must have some kids too.
3.
Oh, do you get to see a lot of them?
Well,
Look at how much better that
get
is
to
already
see
out here.
our youngest daughter who lives nearby.
Oh, that's good. So
And
she's kind of always around and making sure you guys are okay. If you need anything, though, I think you guys are pretty good on your own, though, too. You guys seem to take you actually, I see you, and you take really good care of your wife. You've been bringing her into all her visits. Your wife had Mohs surgery on her forehead, so we had to do some fancy things to close it up because it was pretty big. This looks better already. Look at how much nicer that looks. Oh, you're gonna like this. Now you're gonna come back just to see me.
I'd gladly do that if I was younger, but you're married.
So are you,
Yeah.
for longer than I've
Right.
been. You're such a little trickster. See, because he's allowed to say all these things because his wife's in the room here with him, you see. He's tough. I can actually squeeze him. I put a little numbing in some of these bigger areas, and I knew we were going to have to squeeze because I knew I was going to have to push hard to try to get some of this out. But you can see being on a blood thinner makes him want to ooze a little bit from some of these areas. And some of them are kind of stubborn. Like this one right here, I thought was going to be a much bigger one, but it doesn't want to come out of that hole and get a little bit better here. You're okay, huh? Still
Oh, yeah.
okay? Okay,
Yeah.
good. Because we're still enjoying ourselves if you're okay.
Yeah.
That was a good one there.
String cheese.
Yeah, like silly string.
Yeah. Oh yeah, that.
Yeah, and string cheese. Like you'd think some kind of string. You're starting to like them too, huh? Just like your sister. It looks so much better already. Back here. See how he handles that one. Maybe I won't get it. I don't want to push too hard on him. Goodness sakes. All right, that one needs to be softened up. Oh, here it comes. Almost there. We're going to soften that one up a little. We get to see you again. Because you have a couple whiteheads right here. So a little pressure. I put some numb in there. So we could take some of these out. How you doing? Can you see this one right here? Look at that.
Yeah, it's terrible, isn't it?
No, it's not. It is what it is. Just tells me you lived a good life. I think you might have a whitehead and blackhead for every woman you wooed.
Huh.
You think? Could be close to it?
Could be. I'd rather not comment.
Okay. Run it here because I think you have them. This one's hidden over here. Oh, this is hard to get to. Oh, goodness. All right, let me push this way. I'm going to push against you, okay? Just because it's hard to get into this, but you're not one to complain, so. Until you tell me, Uncle, I'm going to go at it. This is the last one right here. I can't get all that out. There we go. Just needs a little wiggle. Maybe this direction. I can't grab you well enough to push against you. Okay, I think we got as much as that one I can. Get this one here. A couple up here, and then just along the left eye, and then we'll have plenty more to work on next time. But you're gonna lose a couple pounds here, I think, today.
Oh.
I didn't even have to nick these, they come out easily. So when you went into the hospital for your surgery there, a stent, you said, you didn't even have any symptoms? I mean, how did you end up there in the first place then?
Well, they just took an ultrasound of my lungs. And
I see. And that's where it came from?
they detected the... Well, I had an aorta taken out, or a stent put in
Okay, got it.
10 years ago.
Oh, I see.
And it was swelled up side, 6.6 centimeters.
Oh my God.
And then they...
That's dangerous.
Do an ultrasound and on something else, they found 2 more.
I'm gonna see. I think I might need to soften them though with a little bit of a cream here, retin-A first, because these are very small. And I don't want to put too much pressure on you here, even though there's a lot of them. They're pretty small. Yeah, we need to soften these. These are not gonna come out easily. I'm gonna get your forehead again here because that did so well over there. And then we're gonna work on your cheeks the next time, okay?
Yeah.
These are all in the creases of your forehead here. See, you know why you got all these creases? Your eyebrows, your eyelids are so heavy. You got to lift your eyebrows all the time to be able to see. Did you say insurance was going to be able to pay for that or no?
Yeah,
Oh, good.
but it's like considered cosmetic.
It's obscuring, it's obstructing your vision, right?
Yeah.
It is, I can tell, especially on that right side there. So let's give him a little Retin-A. If we have, I hope we have a tube of it or something.
I think we do.
Okay, good. And then we can have him instruct how to use it, you know, a little small little pea-sized drop. It might dry him out, and if it does too much, don't use them. Goodness, that's a dilated pore, let me tell you. And then this one up here, we got a bigger one up here. Yeah, your wife can hold you up, make sure you don't fall forward. Look at this thing, it's just stuck on him. Make sure I'm not hurting you. Am I hurting you? You okay?
Okay.
Okay, I gotta loosen this a little bit. I put numbing around it so that,
He said nothing hurt last time.
yeah, I know, he's a trooper. I'm gonna squeeze it out, see if I can squeeze that out. Are you okay? My
Okay.
goodness, this little friend of yours. I think you're gonna lose a little weight today. It's like a rock. Wow. Look at that area there, huh? That is a big blackhead. You might have the award for the biggest blackheads. My goodness. Not a blackhead, not a black nugget, okay? A gold one. He's so sweet. Did you say you were 90?
Yes, he is.
Wow. And I heard he's got grandkids that are in Harvard and really smarty pants people, huh?
Yeah, we do. I don't know where they came from. just kidding.
I don't believe that. I don't believe that.
No, we
Oh, sorry, sweetie. I'm sorry.
have a granddaughter that's getting her doctorate in physical therapy in
Oh, wow.
May, and one graduating from Harvard. And
Yeah, that is quite wonderful.
yeah,
Okay, let me see. He's got another one right here. Let's see if we can't. I bet you it's going to be the same kind of thing. It's going to come out like that. Just opening it up a little bit so we can get to it. Let me just give it a squeeze there too. I'm going to squeeze your back. Oh my goodness, no, this is under there actually. Look at that, it's under there. Up a little bit more, but not hurting you. It's like a rock under there. You're storing a little rock under your skin. I mean, it's like rock hard. Just make sure, again, I'm not hurting you. I'm gonna pull on it a little bit. I don't know if I can get this out in one piece. It certainly is satisfying when we do that. Let's see if I can. It is, because then you know you got it all. You know, when you get it out in one piece, just make sure I'm not hurting you. Okay, I'm sorry. I'm so sorry. I won't go over there, okay? You okay now?
Yep.
you're okay. Yeah.
Am I doing too much to him? Is he okay? Here it comes. Oh, you're gonna actually, your clothes are gonna fit you better now. This thing is like a hump on your back.
Has it bothered you at all? Have you felt anything bad?
See that? Maybe it's coming out. It's just stuck on you. It's almost like it's like a raisin that gets really sort of like sticky and yeah, it's like a pore liner.
Your forehead has really healed up nicely.
Yeah, it has. Yeah, it's a good
It's
healer.
healed up nicely.
I know you were kind of concerned about that one, huh? Being something, probably because your history, your who was it again?
Dr. Stiles mentioned it, that he said that might be a cancer under there. He said you better get that checked.
Probably because it kind of grew so fast and was quite big. It was just so unusual to be so big.
Yes.
Here we go. Here we go.
Yeah,
Here
my
it comes.
daughter, in fact, the one that was in, she had
Yeah, it's scary.
cancer one on her back.
Oh wow, that one came out nice too. They're like little rocks too. They're hitting her table right here, and they're like making a little rock sound, like when you hit something. Yeah, come there. Look at this. I'm gonna look at this angle. There's like a whole little empty space here too. But I think we got all that. I'm also gonna let this heal on its own because it will slowly get smaller. We've seen this before where they will heal in and get smaller. We can't sew it up because there's just it's like a scarred off sealed area right there.
I think he's relieved, aren't you?
Feels better. Look how much flatter that's going to be. That's going to be a lot nicer. When I pull this and everything, a lot of times it does. Maybe I should put a little bit of numbing on here, huh? He's just not doing so well these days, huh? This is not fun for Memorial Day weekend here. Does that hurt? No?
Not really.
Not. What do you think, Mom? What do you think, Mom?
You doing all right?
Yeah.
Okay. But she's taking out that packing. I think she's
Yeah,
gonna
I can feel
put fresh packing in there.
Yeah, I can feel it, but it's not.
Coming.
Is it hurting?